Okay, good morning. My name's James Danger. I'm an embryologist with more than 50 years' experience in working in IVF. And this is a new set of videos I'm making for my YouTube station to do with recent publications. And the idea is to summarize in 1 or 2 minutes papers that have recently been published for the use of IVF staff, but also for patients to know what has recently been published and to prompt them to ask questions of the doctor when they see them. So I picked out 3 papers on the 15th of July. One is from Human Reproduction on bacterial vaginosis and toxins impairing sperm capacitation, fertilization, and 2 more from Reproductive Biomedicine Online, looking at the outcome of bushfires and sperm selection using magnetic activated cell sorting. So really quickly, point is that so the paper published by workers in the USA asked the question, do toxins produced by bacterial vaginosis bacteria have an effect on sperm function? What's already known, and I have to admit, Human Reproduction is a fantastic journal that lays out very clearly the information one requires to very quickly summarize the paper. So what's already known? Bacterial vaginosis is characterized by disruption of the vaginal microbiota with a decrease in protected lactobacillus species and an overgrowth of anaerobic bacteria affecting up to 30% of reproductive age women in the USA. And the anaerobic bacteria that they looked at was Gardnerella and Pedrotella. In bacterial vaginosis, which is linked to infertility, overgrowth of the anaerobic bacteria in the vagina is accompanied by elevated concentrations of toxic lipopolysaccharides and vaginolysins, which I don't know what they are. But when they looked at and they cultured both mouse and human sperm with varying concentrations of these liposaccharides and vaginolysins, they found that sperm motility and capacitation was decreased, and the movement of calcium was disrupted, impacting on the ability of these sperm to fertilize oocytes. And they argued that if these bacteriostatic toxins contribute to infertility, in part maybe by impacting on sperm capacitation, which is where sperm, once they've been free of seminal plasma, are able to acquire the ability to fertilize an egg. That's what capacitation is, and thereby reducing their fertilizing ability. So the argument here is that if you're an infertile couple presenting for a fertility assessment, one of the tests the clinician should do is a bacterial swab. And if by chance the bacterial swab suggests that there is some evidence of bacterial vaginosis, then maybe they need to address that. Now, remember, I'm not a doctor, I'm a scientist, and this is not medical advice. It's just suggestions that you may like to raise with your doctor. The second paper, which I thought was interesting, came from Australia and looked at an environmental effect of bushfires on IVF outcomes. So in Australia, as you know, we've had a couple of terrifying years with high level of bushfires, and they looked at the effects of their IVF treatment in the 6 months before and after major bushfire events. And what they found was there were trends in the overall embryo utilization rate. That is, where you produce a number of embryos on IVF, maybe 5 or 6 or 7, but how many of those are good enough to transfer or freeze? That's the utilization rate. And it's normally around about half or so. Half of all embryos are suitable to transfer. That there was a reduced number of viable embryos in the groups associated with after the fires, but there was no other really long-term effects in the subsequent ability of collecting oocytes to pick up in the number of fertilized eggs, their development, or their pregnancy rates. So basically, they're saying that even though during the period associated with bushfires, there was some evidence of impacts, some environmental impacts of maybe affecting embryo quality, that in reality it made no difference to the functioning of an IVF cycle and a woman's chance of falling pregnant. The third paper looks at sperm selection for IVF using a magnetic activated cell sorting machine, what they call MACT, to select non-apoptotic sperm for fragmented sperm DNA and the outcomes of this. This is a systematic review and meta-analysis from authors in Spain. And basically, by way of background for IVF clients, IVF techniques, ART, rely on quality of sperm quality for success in some part. while conventional sperm selection methods such as sperm centrifugation or using density gradients or swim-ups are currently used, they often do not select that sperm which have some DNA damage. And therefore, when you use sperm which has some DNA damage, even though the sperm may look functional, it has a lower outcome and a higher chance of miscarriage. So to address this, there's been a lot of studies looking at the advanced selection of sperm using magnetic activated cell sorting techniques, where they're looking for markers on the sperm membrane to suggest that the sperm may be unhealthy, what's called apoptosis. And this is linked to the quality of the sperm which is wrapped up inside it. Now, poor quality sperm, the DNA has been broken into smaller bits, what's called fragmented DNA, and generally speaking, that has no real effect on IVF outcomes, but it does have there's strong suggestions that it is related to the rate of miscarriage. So these authors from Spain have done a systematic review and meta-analysis of lots of papers, and they showed that while cell-sorted sperm to reduce the proportion of sperm with fragmented DNA did not significantly improve the clinical pregnancy rate, spontaneous miscarriage rate, or live birth rate in artificial insemination cycles, that is where the sperm just being inseminated into the uterus, and there's natural fertilization. However, in IVF cycles involving ICSI or intracytoplasmic sperm ejection, the sperm selected did significantly improve the implantation rate of transferred embryos, and particularly for patients with elevated sperm DNA. So when you attend for IVF clients, when you attend a fertility clinic and they do a sperm test, one of the tests they should do is some estimate of sperm DNA fragmentation. There's been a lot of discussion amongst group whether this is worthwhile or not, and a lot of doctors believe it makes no difference because really the pregnancy rate's the same, but other groups show that in fact it can make a difference, the pregnancy rate and the miscarriage rate. And you should ask your doctor when you do a semen analysis if they're testing for sperm DNA fragmentation. If not, why they're not doing it. But if they are if you have high levels of sperm DNA fragmentation, then you may like to ask your clinician whether they can have some form of selection of sperm to reduce the incidence of selecting sperm that has fragmented DNA. Okay, thank you very much. I'll stop there and we will